Hi everyone, welcome to Cancer Answers, where I engage with experts in a constructive dialogue about cancer in Hawaii, the Pacific, and beyond. I'm your host Heather Rifat, and joining me today to talk about how fatty liver contributes to higher cancer risk is Dr. Eunhee Lim. Dr. Lim is a full member in the Population Sciences in the Pacific program, Cancer Epidemiology, at the UH Cancer Center. She is also an associate professor of cancer epidemiology at the University of Hawaii at Manoa. Dr. Lim's research is focused on the role of nutritional, biochemical, genetic, epigenetic, and gut microbial risk factors and their racial ethnic variations in the etiology of colorectal, liver, and breast cancers. Dr. Lim, thank you so much for being here today. To start off, what should people know about liver cancer specifically in Hawaii?
Thank you for having me today, Hader. Liver cancer is very important for Hawaii. Hawaii as a state used to rank the highest in the country for liver cancer rate, and that's because we have a high occurrence of hepatitis B and C. But nowadays there are effective treatments and vaccines available for these infections, so the rates have come down slightly. Hawaii now ranks at third after Washington, D.C. and Texas. The rates are still very high. According to the Hawaii Tumor Registry that's established and operates in the UH Cancer Center, Hawaii has a 35% higher diagnosis rate and a 25% higher death rate for liver cancer compared to the US average. And among the racial ethnic groups in Hawaii, Native Hawaiians are most affected, who have on average 35% more diagnoses and deaths. So on top of this already higher burden from liver cancer in Hawaii, there's another concern, and that's because liver cancer from non-alcoholic fatty liver disease is on the rise.
And what does it mean to have a fatty liver?
We call it a fatty liver when there's excess fat in the liver above 5%.
Dr. Lim, what key reasons cause fat to develop in the liver?
Several different conditions, including chronic high consumption of alcohol. But the fatty liver disease that's of particular concern to us is non-alcoholic fatty liver disease, or NAFLD, NAFLD. NAFLD develops often in people who have abdominal obesity or type 2 diabetes. And because obesity and diabetes are increasing, we are seeing more liver cancer from NAFLD.
Interesting. And how does having a fatty liver contribute to higher cancer risk?
So some of the NAFLD cases, not all, but some develop inflammation, and that causes liver tissue injury. That's detected as a hardened fibrotic tissue. And the more extensive this liver fibrosis becomes, the more likely it will lead to liver cancer or other end-stage liver disease. And even beyond that, because the liver is so important for the whole body's metabolism, having NAFLD has been linked to more premature deaths from other diseases as well, like cardiovascular disease, diabetes complications, and other cancers than liver cancer.
Who is more likely to develop cancer from fatty liver? Men, women, or children?
That's a good question. Currently, two-thirds of liver cancer cases are in men, and that's because more men than women tend to get infected with hepatitis or drink high amounts of alcohol. But for NAFL, we are seeing NAFL in women just as likely, just as frequently as in men. So in the future, we may see increase in liver cancer in women because of NAFL. And in terms of race and ethnicity, we conducted a NAFL study within the multi-ethnic cohort, which is based in Hawaii and Los Angeles. And this was the most diverse NAFL study to date, comparing 5 racial ethnic groups. And what we found was that Asian Americans and Native Hawaiians have a higher tendency to develop NAFL compared to Latinos, whites, or African Americans. For example, we found that Asian Americans who were even normal weight or only slightly overweight had more liver fat compared to peers of same sex, age, and similar body weight, but belonging to different racial ethnic groups. When we compared Asian Americans, which is the group with highest tendency to accumulate liver fat, to African Americans, the group with the least tendency, we saw that Asian Americans were 4 to 5 times more likely to develop NAFL, which was quite astonishing. And we saw a similar, somewhat less but similar pattern in Native Hawaiians, especially women. So we are now trying to understand the reason for this drastic racial ethnic difference in the tendency for NAFL. We are analyzing omics data and see some racial ethnic differences in genetics, diet, other lifestyle factors, and gut bacteria that might be driving this NAFL disparity.
And lastly, what are some treatment options for fatty liver?
Unfortunately, there are no FDA-approved medications for NAFL, although some drugs are currently being tested in clinical trials. But there are some lifestyle changes that have been shown to be effective to reverse NAFLD, such as weight loss by 5 to 10% and eating a Mediterranean pattern diet. So we are now testing a combined approach of these, weight loss and Mediterranean diet, in a new study to lower intra-abdominal fat because this type of harmful fat leads to NAFL and also other diseases. The study is called the Healthy Diet and Lifestyle Study 2, or HDLS2. It's led by Dr. Loic Le Marchand and Dr. Carol Boucher at the UH Cancer Center. It's sponsored by the National Cancer Institute, so it's been funded through a competitive review process, and especially based on the success of our previous intervention. So for eligible participants, what we do is we will use state-of-the-art scientific methods and provide individually customized dietary counseling for 6 months and measure intra-abdominal fat before and after the intervention. We are now actively recruiting participants and specifically looking for men and women who are between 35 and 69 years of age, who are slightly or more than slightly overweight, and who are in one of the target racial ethnic groups, which means having Native Hawaiian, other Pacific Islander, Japanese, Chinese, Korean, or white ancestry. So those of you who are interested and eligible, please contact the study at 808-237-3901.
These were indeed some great insights. Thank you so much, Dr. Lim, for taking out time for this interview. It was a pleasure talking to you. That is all for now, listeners. Stay tuned for more weekly episodes coming every Thursdays at 12 p.m. on Apple Podcasts, Spotify, Facebook, and YouTube. You can follow our social media pages at UH Cancer Center, and you can also log on to our website, uhcancercenter.org. Until next time, take care. Bye-bye.